So good afternoon. Thank you for coming here today. On behalf of my fellow board members of the IndoAmerican Political Action Committee, also known as IAPAC, we welcome you to this event this afternoon. Rupa Gear, Dr. Rupa Gear, is the driving force behind this event. So I welcome her. Come on over here, Rupa, and tell us more about this event. Thank you.
Thank you. Thank you, Sanjay. So I'd like to introduce our distinguished panel. We'll be covering this healthcare law from different perspectives. We're going to look at it in first from policy guidelines at a national level. Then we will look at how it applies to Texas. Then we will look at how the insurance companies, how does it affect our premiums? So we look at it from an insurance perspective. Then we will look at it from a hospital perspective. And then finally, how it affects small businesses. So how does this law impact the small businesses? This is the range of, the topics that we're going to cover today. And we have a moderator who is a physician, very familiar with the healthcare law, who will then moderate and, start the question-answer session. So first, I'd like to perhaps if we could have the agenda up, so I can just introduce the agenda. So we will start with the panel discussion, which will be roughly about 8 minutes each, then followed by about 15 minutes of questions from the moderator, Dr. Reddy, and then it'll be opened up to the audience, the entire floor, for about 30 minutes. It'll be question and answers. And after that, we'll have some refreshments. And I hope at that time, anybody who has got further questions and wants to interact with our panelists, you can get to know a lot more at that time. So that would be at 4, and we wind up at 5 o'clock. So first, I'd like to introduce Mimi Garcia, our first panelist. And I want to especially thank her because she accepted the invitation at the last minute. Those of you who replied to, who registered on the website must have seen Dr. Jonathan Gruber. He was originally going to be covering the policy at a national level. He unfortunately couldn't make it, and Mimi has graciously accepted at the last minute. So thank you again. So she is the Director of Healthcare Organizing for Engage Texas. This is a nonprofit organization that is based out of Austin, Texas, and it's statewide. She graduated from the Brandeis University with a master's in public policy, and in her studies, she has specially focused on health policy issues and has studied the Massachusetts healthcare reform, and she's an active community organizer and has coordinated several grassroots campaigns in Texas related to healthcare. I will go on and just talk about all the panelists here in one go, and then we will, start. Each speaker would then speak. The next speaker is going to be Dr. Charles Bigley. He's a professor of public health at the UT School of Public Health. It encompasses, management, policy, and community health, all three of them. He's a director of the Houston Health Services Research Collaborative, and he's an adjunct faculty member at the Rice University. So this is in economics. He has extensively published, in the last 25 years, including one of his publications that is used as a textbook and is now in its 4th edition. He teaches master's and doctoral level courses in health policy, health services research, and health economics. His research interests include disparities in healthcare, performance of healthcare safety net systems, and the healthcare reform. The next speaker is going to be Mr. Terrell Rogers, who's a senior health executive at the United Healthcare, and he's been in that position for the last 10 years. United Healthcare is one of the largest insurance companies in Texas. He has a bachelor's in business management as well as an MBA in global management and is currently pursuing his doctoral thesis in organizational leadership. He has worked for several other insurance companies, and that include AIG, Pacific Care, Cigna, and Aetna. He was the immediate past president for the Houston Association of Health Underwriters. And for those of you who don't know, the largest chapter for this exists in Houston. And he's just the immediate past president. The next speaker is Dr. Robert Behar, who is the founder, chairman of the board, and CEO of the North Cyprus Medical Center. He is a visionary, and he wanted to do something different in the hospital system, and he developed a hospital with a state-of-the-art equipment and amenities that puts its patients as well as physicians first. Dr. Behar graduated with honors and received his MD from the University of Chicago's Pritzker School of Medicine. He completed his internship at Northwestern and his residency at Stanford, and that was in radiation oncology. He started his practice in Florida and then relocated to Houston, where he formed the Western Radiation Oncology Associates that has been successful in starting 5 cancer centers, including the North Cyprus Cancer Center. The final speaker is Mr. Stephen Soful, who is, am I saying it right? Okay. So he's a healthcare executive who specializes in packaging healthcare plans for small businesses, small employers, as well as large employers. That's his forte. And he's a president of a company called Benefit Science, which uses big data analytics, when you're dealing with very large volumes of data. So using that data to ultimately reduce healthcare cost. And you do that by, this is for the employers, by analyzing all types of data that are related to a healthcare plan. So, and then finally, I would like to introduce our moderator. That's Dr. Guru Reddy, who's a gastroenterologist. He got his training in gastroenterology and hepatology, including liver transplant at the Baylor College of Medicine. Dr. Guru Reddy successfully established one of the largest gastroenterology, hepatology practices in North Houston in 1988. He remains on the clinical faculty at the Baylor College of Medicine. He's given numerous talks on a variety of subjects that include, of course, gastroenterology and liver topics in the past 24 years, to primary care physicians, to gastroenterologists, nurses, and patients. So now I'd like to invite our first panelist, Mimi Garcia, to talk about the Affordable Health Care Act, but from a national perspective.